Okay, so we're going to be talking about livers from fasted rats acquire resistance to warm and cold ischemia injury. Okay, so liver transplants are a pretty common procedure done in patients with diseased liver or failing livers. There's around 8,000 liver transplants per year, and around 5 years post-transplant, the survival rate is around 75%, which is pretty high. It is known that hepatocellular injury and organ quality can affect the overall success rate of these transplants. And so what the authors wanted to do was determine the effects of nutritional status of the organ donors. And this is because fasting has shown to actually increase the chance for hepatocellular injury and decrease survival rates. So the hypothesis that these authors were wanting to test was that fasting prior to liver transplant can increase the injury to the liver caused by the warm or cold ischemia.
So what they first wanted to do was examine how fasting affected the liver. And so what they did is they fasted rats for up to 4 days, and then they removed the livers. They did some of them after day 1, some after day 2, some after day 3, and some after day 4. And they weighed the livers in total, and then they measured the total tissue water of the livers and measured the amount of glycogen in the livers. The results showed that the liver weight decreased with fasting, so the overall weight decreased the longer that the rats were fasted, and then the glycogen was nearly depleted after fasting for 4 days. There was a big decrease between from day 0 to day 1, but then at day 2, nearly 95% of the original glycogen stores had been depleted. First, they looked at how fasting in warm ischemia affected the survival rates. So they did this, they fasted the rats anywhere between 0 and 3 days, and then the livers were removed and stored at 37 degrees Celsius or normal body temperature for 45 or 60 minutes. They had 2 groups. And the results showed that longer fasting time increased the survival rates, but then there was no correlation shown between the time of warm ischemia and survival rate. As you can see on the graph, the 0 days for 45 minutes had 50% survival rates. The 0 days for 60 minutes had 0% survival rate. But then when you go up to 3 days of fasting, they are both 80 and 89%, so they're really close in that one. So there was no real correlation between the two. Then they looked at fasting and cold ischemia and examined how it affected the survival rates. So in this one, they fasted the rats between 0 and 4 days, and then the livers were removed and stored at 4 degrees Celsius for either 30 hours or 44 hours. The results showed that longer fasting time once again increased the survival rates. And then there was also a little bit of a difference between the 30-hour and 44-hour groups. In the 30-hour group with 0 fasting days, the survival rate was 50%. The same thing was true for 1 to 3 days. But then in 4 days, it had a 100% survival rate. However, in the 44-hour cold ischemia time, the 0 days fasting had a much lower survival rate than it did in the 30-hour time. And the 4 fasting days in the 44-hour group had a slightly lower survival rate.
Okay, so the overall hypothesis that the authors were wanting to test was that fasting prior to liver transplant will actually increase liver injury and decrease survival rates in warm and cold ischemia. And so what the authors actually found was that survival rates increased in both cold and warm ischemia following long-term fasting, which goes against their initial hypothesis. And another thing they found was that long-term fasting actually had a higher survival rate than short-term or no fasting at all. And they found that glycogen was not a factor and was not necessary for the survival of the liver. But what they deciphered and what they decided was could be a cause of the survival rate was an increase of ketone bodies and amino acids in fasting. And so these ketone bodies can serve as an energy source in the liver and in the brain. And these amino acids, specifically alanine, can be used in gluconeogenesis as an energy source. And so some future directions that could be done were to examine why exactly the fasted donors had a higher survival rate than fed donors, and see if there's any underlying factors other than the ones mentioned before. We also would like to see if this study would to work in other animals or if it could correlate to humans in some way. And so finally, we could measure the levels of ketone bodies in the donors, as they mentioned before could have been causation.
So a few critiques that we had of the study. One was the small sample size that they used. They did not have very many rats in any of their groups, so the results were not statistically significant. So if the study was repeated, it should use more rats in each group. They should also perform this test in other animals to see if the results hold true across other species or if the results are species specific. Also, the authors did not talk about why they chose the certain ischemia times that they did, so it would have been nice to have a rationale as to why they chose those specific times. And then lastly, the authors did not mention anything about testing the donor and recipient to see if they were a good match. And I know that in humans, you have to match the donor and recipient to see if the transplant will actually work. So this thing could also be true in rats, and that could be a source of error in the survival rates. And then here's our source.